Energy drinks, those brightly packaged, aggressively marketed beverages promising boosts in alertness and stamina, are far more than a temporary pick-me-up for people with hypertension. They are a serious and often underestimated cardiovascular threat. These drinks combine high levels of caffeine, sugar, and sometimes other stimulants like guarana or taurine, creating a synergistic effect that can sharply elevate blood pressure, strain the heart, and damage blood vessels over time. For individuals already managing high blood pressure, energy drinks are not a minor indulgence. They are a potent hazard with both immediate and long-term consequences. The most obvious danger lies in caffeine. Energy drinks often contain caffeine levels far higher than a standard cup of coffee, sometimes 200 to 300 milligrams per serving or more, paired with sugar that delivers a rapid spike in blood glucose. Caffeine stimulates the sympathetic nervous system, causing temporary vasoconstriction, narrowing of blood vessels, increased heart rate, and elevated blood pressure. While occasional moderate caffeine intake may be tolerated by healthy adults, the doses found in energy drinks can produce acute blood pressure spikes that are dangerous for people with hypertension. Even a single energy drink can increase systolic blood pressure by 10 to 15 millimeters of mercury or more, enough to stress the heart and arteries. The combination of caffeine and sugar is particularly insidious. Sugar provides a rapid energy surge, but also triggers insulin release, contributing to metabolic stress and weight gain when consumed habitually. This creates a dual mechanism. The stimulant elevates blood pressure acutely, while repeated sugar exposure promotes obesity, insulin resistance, and inflammation, all of which exacerbate chronic hypertension. Regular consumption of energy drinks establishes a dangerous feedback loop where vascular stress and metabolic strain accumulate silently over time. Energy drinks are often consumed repeatedly throughout the day, especially by students, athletes, or shift workers, which compounds the problem. Unlike a single cup of coffee, multiple energy drinks can produce cumulative spikes in blood pressure and heart rate, forcing the cardiovascular system to operate under repeated stress. Habitual use can lead to chronic elevation of blood pressure, stiffened arteries, and increased workload on the heart. Over months and years, this repeated stress significantly raises the risk of left ventricular hypertrophy, arrhythmias, and heart failure. Beyond caffeine and sugar, many energy drinks contain additional stimulants and additives: taurine, guarana, ginseng, B vitamins, and herbal extracts. While marketed as beneficial, these compounds can potentiate the cardiovascular effects of caffeine, creating unpredictable spikes in blood pressure and heart rate. Some formulations have been linked to palpitations, arrhythmias, and even sudden cardiac events in vulnerable individuals. For people with hypertension, these additives represent an additional hidden risk, amplifying both immediate and long-term cardiovascular strain. Energy drinks also often interact dangerously with other dietary and lifestyle factors. They are frequently consumed alongside high-sodium fast foods, processed snacks, or sugary beverages, further compounding blood pressure elevation and metabolic stress. Alcohol is another common co-consumption, which may mask the stimulant effects while exacerbating cardiovascular strain and dehydration. This combination creates a high-risk environment for both acute blood pressure spikes and chronic vascular damage. The long-term consequences of habitual energy drink consumption are particularly concerning. Repeated high blood pressure episodes from caffeine spikes, combined with sugar-induced metabolic stress, contribute to chronic arterial stiffening, endothelial dysfunction, and kidney strain. Over time, the heart and vessels lose resilience, blood pressure becomes harder to control, and the risk of stroke, heart attack, and chronic kidney disease increases significantly. The most dangerous aspect is that the harm accumulates silently. Individuals may feel normal between energy drink consumption episodes, unaware that structural damage is occurring in their cardiovascular system. In conclusion, energy drinks are far more than a temporary stimulant. They're a potent, multifaceted threat for people with high blood pressure. Their combination of high caffeine, sugar, and additional stimulants produces acute spikes in blood pressure, chronic vascular stress, and metabolic strain, all of which can accelerate hypertension and damage the heart, arteries, and kidneys. Habitual consumption establishes a vicious cycle of blood pressure elevation, arterial stiffening, and cardiovascular risk. For anyone managing hypertension, energy drinks are not a harmless pick-me-up. They are a high-risk beverage that requires strict avoidance to protect both immediate and long-term cardiovascular health.